I'm sorry, we discovered a dead baby in the bathroom.
Oh my gosh.
I'm sorry. They came out at me and I didn't know what to do.
Lexi, I told you about this.
But it
I just asked you, baby, to tell me the truth.
It was not crying or nothing.
What did you do to it?
Okay, stop right here. Stop. Number one priority, guys. Number one priority is she just had a baby. I don't know if she's delivered the placenta. She's bleeding significantly.
Yeah.
I've spoken to the obstetrician at Loveless. They want her out there as soon as possible.
Okay.
I obviously need your permission to transfer her for medicals. She needs to
She's
be
19.
Oh, you're right.
But she is a student too.
She's still 19 years
You're
old.
right. You're right. She needs to. I'm sorry, I forgot she's 19.
Keep out of me.
But you need to make sure that you're safe. I need to send you to Loveless to labor delivery. Will you please agree to that?
Yes.
Yes.
Okay, great. I'm gonna work on that. I'm sorry about this, but in terms of delivering a baby and it looked like you tried to hide it, we do have to have the police involved.
And nothing was crying. It came out with nothing.
Unfortunately, it's just like the Lakin case. There's no one who said that Alexi verbally told them that she was pregnant. There are, however, coincidentally, cheer photos of her in her cheer uniform, just like Lakin, where she does look visibly pregnant. You can see the perfect outline of a bump, and she's not someone where she carried weight all over her body. It looks very much so like she's pregnant. She did wear baggy clothes, rumor allegedly throughout her pregnancy, but then right after delivering went back to very tight clothes. So it seems as though she was trying to conceal something, but it's unclear if she actually did tell people that she knew she was pregnant. My belief, based on her reaction and what happened, is that she certainly knew. I've also been pregnant with 2 kids. You feel it, you know.
Yeah. Sharonda, is it possible for someone 19 years old to not know that they're pregnant or not acknowledge
I think it is. Yeah, absolutely, Vinny. I think it's extremely possible and highly possible for someone to be pregnant and not know it or not acknowledge it. Psychosis starts very early in pregnancy, as early as 2 to 6 weeks, and it can go on for at least 2 years after the child is born. When someone is not interested in being pregnant, or when they are interested in being pregnant, they will convince themselves of whatever they need to for survival, and that's where the mental health part comes in. That blockage is so important, and it is so imperative that I think we definitely have to consider that when we're asking, did someone know or did they not know? What type of mental blockage? If the relationship changes, the body's changing, hormones changing, society is changing around them, they can definitely block it out to the point where they don't even believe they're pregnant, or if they really wanted to be pregnant and they could believe that they were, even if they weren't. So I think that those things must be considered when we're wondering if someone knew about their pregnancy.
Now, the other part of this is, and we were looking at that video, Sharonda, the fact that afterwards she doesn't acknowledge it, she just takes the newborn and places the newborn in the trash and then walks out as if nothing happened. What are your thoughts? Does that tie into which side of all of this?
I think it ties into shock. I think when she says, I need to go to the hospital for back pains, there's clearly a disconnect. And I think in the process of going to the restroom, pushing out a child, and ultimately it can feel like a bowel movement when pushing out a child. And she says it wasn't crying. It didn't say anything. So those words of it, there's a total disconnect. So I think that in that moment, there was this shock. There's a reality that takes place in that room with the doctor and her mom. And I think that's when we start to see more of that shock wear off and that reality set in. But people can definitely, especially mothers, can go through their entire pregnancy and time afterwards in a space of delusion.
Let's take a listen to the mother, Alexi's mother, and Alexi's boyfriend who are in the waiting room. Again, the body cam video is rolling as we get to hear a conversation about what they knew.
So what did she come here for that she told you?
She told me she had back pain.
That's it?
That's it.
Okay. Has she been having back pain before?
Yeah, pain for her and her hips is not,
she was born with like her, I don't know, it was like crooked.
Her spine?
Okay, because my ex-husband, he hit me. He beat me whenever I was pregnant with her. So she was early. So she had some problems with her hips. Like I always had to take her to the chiropractor to get adjusted because she couldn't use, like, she was always getting constipated. Like she had to get lined up, whatever. So, I mean, I've been taking her to chiropractor because I always thought, you know, well, this time, you know, I didn't know. I honestly didn't know she was pregnant. I didn't know. I just thought, like she said, I had back pain, Mom, my hips are hurting me. I think I need to go to the chiropractor. I said, okay, let's go tomorrow. But she was like in really a lot of pain and, you know.
When did it start?
Like the pain?
Yes.
Yesterday she said it was really bad, that her hips were hurting and her back. And then last night we were on the phone together and she said her hips were hurting bad. I asked her if anything else was hurting. And she said just everything. And she went to sleep.
But she's a cheerleader too, so she's big in cheers. They have a cheer competition. She works out. I mean.
And she's been active this whole time?
Yeah, she's been active this whole time.
Annie, so here, the mother, I don't think the mother had any idea this was going on. The boyfriend obviously said, I can't see him, but he seems oblivious to this as well, which is, and we saw the cheerleading picture. Like, she looked much different there than she did otherwise. What are your thoughts about what's going on here in the home and with the boyfriend?
I think it's easy that maybe he didn't know what was going on or didn't know the extent of it, although I always do question, of course, when there are relationships in the partner, depending on, you know, the level of intimacy, what they may or may not know. But to your point, it does seem as though they didn't know. But I will say, too, going back to the body cam footage in the hospital room, to me, there is something that does not sit right with the reaction of the mother and Alexi, as though they are not, I don't want to say performative, but there's just something that feels so disconnected and disjointed, as though they knew that what their response needed to look like. That's just my personal opinion.
Yeah, and that's one of the reasons that they're fighting to keep that video out of any trial, and that is still being litigated. Sharonda, looking at mom and daughter and that relationship, mom was abused by her father, but it seems that they have a relatively close relationship, and they, you know, live in the same house, see each other every day. What are your thoughts about mom?
I think that there's definitely something there when someone volunteers information like that. It definitely is a cry for help in many ways, but it's also lets me know that there's a part of them that wants to disconnect from reality and wants to create a space of sympathy or create a space of empathy from those who are listening to them. To say, okay, well, this happened to me, so I'm believing that this could have possibly been a reason for why she's that way. And so when women are abused and they have this fear that their children will be as such, or that their children will be a product of that, they can go into this defense mode that will often have them deny when their child has done something either abusive to themselves or have done risky behaviors. And that's what you're seeing here, that level of protection. So protecting themselves from the image, protecting themselves from the truth, protecting themselves from even having to mirror whatever it is that have gone on in their past that they're ashamed of. And that's what I see happening in the waiting room.
Given the investigative information and the examination findings, the cause and manner of death are best certified as follows. Cause of death, entrapment. Manner of death, homicide. The air in the lungs and stomach and no evidence of decomposition is consistent with the baby having been born alive. Entrapment occurs when an individual is in an airtight or relatively airtight container, in this case, a tied plastic trash bag, and consumes all of the available oxygen until there is no longer enough oxygen to sustain life. That's what the prosecution is saying. Gary Mitchell, the attorney for Lexi Treviso, has been on the show many times. I asked him about this. Here's what he had to say about manner of death.
We're still looking into that. Several experts are looking into that, including forensic pathologists, a number of doctors. more likely than not, the child may have taken a breath or two, according to the Office of the Medical Investigator, but the morphine was a critical problem for this child. We're not even sure that the autopsy is correct. Other doctors disagree with that. And so we think the child was not born alive, certainly did not breathe properly. I mean, it had 14 milligrams of morphine per milliliter in its body. That's a horrible thing, and that's really causes major breathing problems, along with some of the other drugs that had been given to her because of her low back pain. Even though halfway through they knew she was pregnant, they continued to give it to her.
A very short-term acute morphine exposure. The child is born. If the morphine is going to have an effect, it might decrease the respiratory drive a little bit, but I don't think it would cause the child to die from the morphine. The child's going to die from being placed in a plastic bag and suffocating. The morphine may have made the child breathe a little less, but ultimately it's being placed in the bag that causes this child's death. I think the morphine at most would cause the child to have a decreased respiratory drive, but the fact that the child's in the bag is why he died.
And how long would that take, a baby in a bag? Are we talking seconds, minutes for a newborn?
Depending on the size of the bag, how much air would be in the bag. If it's a smaller plastic bag, we're talking a few minutes, maybe at most. A bigger plastic bag, you might push it out a little bit longer, but it is going to be minutes at most, even if it is a big bag.
All right, Serena Townsend, how does this all play inside of a courtroom? You're going to have a battle of experts here talking about how a newborn died.
Yeah, it's very tragic. You're already going to have a jury that might be eager to convict just based on how gruesome this case is. Certainly, a defense attorney is entitled to and often does have an expert of their own to give an alternative theory. Sometimes, again, jurors don't love that. They feel that that's a hired gun. And it might be smart for the defense to shift focus instead of focusing on whether the baby was alive or not at the time, since it's hard to argue with science. It might be smarter to shift to her mens rea, her intention. Did she really intend to kill this child, or did she panic as a young girl not knowing what to do?
And how about this aspect of the case, Serena, which makes it very unique? They've already filed a malpractice lawsuit against the hospital. I could see them pointing the finger at the hospital here, saying, hey, you did the test, you knew the results, yet you did not engage in the type of care which would include not allowing her to go to the bathroom by herself.
Totally think that's fair game to be argued, and I would argue it as well. I mean, if you're going to say that this 19-year-old girl who's pregnant for the very first time should have known how to act under these circumstances, how can you then also say that the hospital did everything right by giving her morphine after knowing she was pregnant, allowing her to navigate to the bathroom all by herself at that time, and not really, oversee this entire process as closely as they should have with their scientific background and their experience. So I would play that role too.
Yeah, Dr. Kendall Crowns, do you have any opinion on the role of the hospital and the treating physician, the treating nurses, and the health workers that were there, treating her as a patient? Because she came to the hospital as a patient for back pain, and she's allowed to leave the room, and that's where, she gave birth, and outside of getting any help from anyone. Any thoughts about that?
So they're treating her for pain. That's a given. And the fact that she wandered off to the bathroom without someone supervising her, I wouldn't have an opinion one way or another whether a pregnant female is not allowed to be in a bathroom by herself. I wouldn't have an opinion on that at all. But I feel that them treating her for back pain and giving her morphine and then finding out the child's pregnant, the mother is pregnant. I don't think, again, the baby is that affected by the morphine. It's more the baby had it on board and died with it, not of it. The kid's
Makes
going to die
sense.
no matter what because it's placed in a plastic bag.